Today, on the occasion of World Mental Health Day, we extend wishes for health, happiness, and the best of mental well-being. The global COVID-19 pandemic has caused many of us to confront the emotional, relational, and psychological traumas we've experienced. Issues we may have masked by busying ourselves with work and entertainment were suddenly brought to the forefront. Many of us lost incomes and livelihoods. Many of our plans had to be put on hold. There were periods when some of us had to be placed in homes where there was tension and discomfort. Our usual means of stress relief were no longer available. Then, when the lockdown was over, we saw glimpses of normalcy and positive expectation, only to be jolted by the disappointment of a resurgence of infections, an escalation in numbers, and the threat of variants that were deadlier and more infectious. Many of us had doubts about the efficacy and safety of the new COVID-19 vaccines. We were bombarded with information, misinformation, and disinformation until we could no longer distinguish between truth and error. We were distressed by the idea of losing jobs and livelihoods should we not take the vaccine. We wondered at the urgency of taking the vaccine. And all this added to our distress and made us even more uncomfortable, further compromising our sense of mental wellness. But there is hope, and there is help. And if you feel overwhelmed by the numerous decisions you must make, or the confusing tangle of information, or the threat of infection and illness, if all of this is compounded by the everyday challenges of life, wrapped up in the memories of your traumatic experiences, you could consult with a professional who could help you make sense of all this by giving you a new perspective and by helping you discover the mental tools and behavioral skills that could help you navigate these difficulties. On this World Mental Health Day, I join with the administration and staff of the Davis Memorial Hospital in urging you to rid yourself of the stigma surrounding mental illness or disorder and normalize seeking help when life's challenges seem overwhelming. I wish to remind you that seeking help is not a weakness, and mental illness is not a personal failure. And just like you seek the assistance of medical professionals when you're physically unwell, seek out the services of counseling professionals when your mind is unsettled. Seeking help is not a weakness, it is a superpower. You owe it to yourselves to do everything in your power to enjoy the best of mental wellness today and always.